Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope you're having a great day today. I want to talk with you about palliative care, which is something you all may or may not be familiar with. Many of you are familiar with hospice, and and that's one of the things that we think about quite often for our pets. But what we don't think about often is kind of what we can do in between. Does that make sense? So if you think about, okay, golly, my pet's got something dreadful and there's hospice available, but what do you do in the meantime? So hospice, let me back that up a little bit and kind of explain the difference if I can. So hospice is it's an organization on the human side, and it's also become a thing on the veterinary side. So I'm going to copy a link into the comments so you can kind of get to the pet version of it. So hospice is really more for pets, again, that are terminal. Literally, their lifespan is going to be somewhere on the order of 3 months, 6 months or less. Palliative care is for any person or any animal that has something going on that's chronic, and we're not going to cure it, but can we just help them feel better in the meantime? So Dr. Atul Gawande on the human side wrote a book called Being Mortal. And it's about, he is a doctor and his father was a doctor, and it is, and I'll put the link to that here in the comments as well, but he details how medicine has failed us humans as we age, and sadly veterinary medicine has emulated human medicine. So he discusses, his father develops I believe it was a cervical tumor, and his father was a surgeon in his 70s and working still as a surgeon. Hopefully Suzanne, it has unfrozen. And so it details helping his father navigate his way through cancer in a position where it's not quite going to be curative if they do surgery, but maybe later. What do you do? But it's a very interesting story. It's a very interesting and humbling look at how medicine has failed us as we age. We took this concept that we have to heal at any cost, and what we are finally beginning to realize is that there's a lot of things we can do, but should we do them? So are they actually, like, on the human side, especially with cancer, we are so afraid of it that we do all this insane stuff, and it just crushes the quality of life that people may have, where they can spend it with their families, spend it doing things they want. So that's, golly, it's just such a deep passion of mine, because my mom realized this about 30 years ago. She said there's a lot worse things than dying, and that's the truth. So how I got into this was with my own dog, Arnold. And if you haven't read that blog post, that story, I'll copy the link again here. But Arnold was really a remarkable dog. He was an English setter, Brittany Spaniel, and he was just hilarious. He was such a clown. He was my buddy, like all of our dogs end up being. But he went to the office with me. He'd make people feel better. He didn't mind putting on costumes and going to events and all of that. There's some great pictures of him on that blog post as well. He lived to be about 17, and it was about 6 months too long. So this is my first experience with one of my own pets where, he didn't have anything that was going to kill him. He was just flat wearing out. And this is where in humans, they list the cause of death as natural causes. And we don't use that in veterinary medicine, which is a shame. And we also don't begin to approach how we care for our pets when they're heading towards that death of natural causes. I mean, that's a beautiful thing. Few of us get the grace to die with peace like that. I have to tell this story. Jane Elder, dear friend, dear client, had this marvelous dog named Gus, who you guys have seen me talk about on broadcast before. And Gus was phenomenal. He had a jaw cancer, he had surgery. I think he lived another 18 months or maybe 2 years after that. And, so he was getting towards that state of natural causes. And it's so hard to realize when you're in it, but this is what I love about this story. Jane took him for a walk, his favorite thing to do in the world. It was a beautiful day. She came home. The other dog is younger, so Jane has to walk her separately. And Gus was so happy, wagging his tail, laid down. She took the other pup, Eva, for a walk, came back, and Gus was collapsed. He was ready to go. And that's where she ended up having to, get some assistance, literally euthanasia, to help him leave the planet. But the things that she did in the meantime, from the time of sickness to the time of, his demise, was a lot. She kept him comfortable. He had some arthritis. She kept working on keeping the cancer from recurring. So she did all of these things. That is palliative care. What makes him feel bad? What can we do to help him feel better? So I hope that makes some sense. I'm going around this a little bit sideways, but that's what palliative care is. What is your goal for your pet's quality of life? And I kind of put that in the email yesterday for the folks that are on my email list. But the first question is, what does quality of life mean to you and your pet? Are you expecting your 12-year-old dog to be able to go out and run races? No, probably not. Would you like your 12-year-old dog to act like he was 10? That's a good goal. So what can we do to restore mobility? What can we do to restore comfort? What can we do to help prevent things from propping up? So what can we do to prevent escalations in kidney disease, liver enzymes, all these things? And this is where nutrition and supplements come in. If we can head these things off at the pass before they become a problem, fantastic. If we can use nutrition and supplementation to help improve the quality of life, how your pet feels, the things they're able to do, that's the whole goal. So for Mona, so we're at this junction with Mona. She is 15, working on 16. She'll be 16 in July. She is definitely slowing down. We have to do a lot of things like massage her and use inflapotion and some supplements to reduce her pain and discomfort. She's starting to get a little confused here and there, so what can we do to help with that? So Mona's perfect day, and it has been since she was 10, so we're many years past that, is to be able to get up, go sniff around outside, get breakfast as soon as possible, go to the potty, come back in, take a nap under her blanket in the sun, go for a walk in the afternoon, and then, get supper and hang out. So she's really happy sleeping, being able to see what's going on outside in the world. And so what we do when we take her for walks is we'll carry her down steep grades and up steep grades and just let her walk on the flat. That keeps her happy, keeps her moving a little bit, and it keeps her from hurting herself. Because what we'll see a lot of these senior pets do is try to do what they could do when they were 6, and they just can't. They don't have the chi or the energy for it. So at this age, it becomes about conserving your chi and for the things that are really important. So what we think are important are big things for our guys, but what they really want us to do is to get better at just being with them. So, and that can be taking a walk, That can be sitting in the sun together, petting your beloved and just stroking them, or just kind of hanging out and looking at the day go by for 15 minutes even. They want that so much. They just want us to be present with them. So I hope that makes sense to you. Over everything I've found over my years of practice, when people spend more time just being totally not distracted, no cell phones, no television, all of that stuff, they do so much better. They are so much happier. You're happier because you're content, quiet, and settled. Now, so that's a good way to start planning out kind of what quality of life will mean for you and your pet. And then the next things are, okay, what can you do? Pain relief, food, massage, supplements, movement. Those are all so important. If we are painful and we stop moving, we become more painful. If we are painful and we continue moving, it helps to relieve the pain somewhat. So that's so important. Look at what's going on. How do these small changes affect how your pet feels and responds and acts? What can we do to help them feel better? Part of why I love home cooking is that I can pour my love into the food, and that love, and this gets into the woo-woo, so you'll have to pardon me, but this is really how I feel, and I think that many of you who are CrockPet chefs feel as well. You pour your love into that food, and that food is able to nourish your pet so much more. Just think about, if you go to a restaurant and have a special meal, that's wonderful. But when you go to someone's home and they've cooked you this meal and you can feel it. And in restaurants too, when the chefs are young and they're really into what they're doing, they are pouring their soul into what they are preparing for you. And that makes the food taste so much better. You can feel that love. And that's what we can do for our pets. It makes them happy. They're delighted to eat, and they are, they're so much healthier for it. But the way that I perceive it is that I'm able to pour my love in, make the food nourish them, and that becomes part of my reward, is to see their delight and their happiness in what they're eating. Now, the next thing I want you to think about are what are goals for your pets as they age. What are your boundary lines? Is chemo, if your pet develops cancer, is chemo something you're going to pursue? If so, how much? And where do you draw the line about this is not helping, this is further hurting my pet? So, in practice and in my consultations, what I do is what I consider integrative medicine. And so what that means is I incorporate conventional medicine. I take what actually helps out of that. So NSAIDs for an arthritic pet, Mona is, as I said, 15. She needs some meloxicam about once every 10 days to kind of keep her moving and keep her feeling better. And this is kind of one of the concepts I want you to get. You don't have to give this stuff every day. Titrate the dose down. This is the problem, is that so many of my colleagues will write a prescription for something and then they're just on autopilot. They're not checking in. Is this working? Is this helping your pet? Is it not? What do we need to do? What do we need to help adjust? So the other thing is, the big one is chemotherapy. Okay. Or cancer. Are you going to do surgery? Well, a 15-year-old dog looking at surgery. If we have a potential to remove the tumor and stop its growth for 2 years, and so, Mona lives out her normal lifespan, would I consider it? Absolutely. Because she's healthy enough to undergo anesthesia. Now, if we take somebody else's pet that has borderline congestive heart failure, kidney disease that's kind of trying to get into trouble, is that pet going to do well with surgery? Probably not as much. And so that option becomes not as good unless we can prevent something life-threatening and we're willing to risk the consequences of the surgery, of the anesthesia with this pet with other healthcare issues. So that's something that's really important too. And remember, you may draw a line now, but you may find that down the road that line wavers a little bit. So the most important thing is to have clear goals in your mind, but have the ability to pivot when you see another opportunity that may be helpful without creating diminished health for your pet. Now, lastly, the thing I want you to think about is, what is your pet's bucket list? What are the things that he or she really loves to do that you used to do a lot when you were both younger, and maybe you're not doing that as much now? What out of that list of things is something that your pet can still do? So in that story about Arnold, what I talk about is when I first got Arnold, I was living out on the beach, and I'd moved inland somewhat onto the marsh, which he still loves. So I took him out to the beach thinking, okay, I'm going to do this. We're going to take him home and put him to sleep so that he's not suffering anymore. Well, this is the astonishing thing. We get to the beach, and he's just, knocked out. And he sits there for a while, and I'm sitting there with him. We carried him onto the beach because he really had a hard time walking there. He saw a kite surfer out in the distance. He looks up. He is the most alert I have seen him in months. And he gets up and he starts walking down the beach gently, watching the kite surfer go. Now remember, he's a setter, so he's a birdie dog, so it's a giant bird he has to go get. So we went home and he felt better. He felt really good. So we shifted a few things around, and I took him out on our dock every morning after that. To tell a very hilarious story. So I'm out in my bathrobe. We're walking down the dock, and I'm not paying enough attention. It's low tide, and he stumbled a little bit and fell off the dock into the mud. And he's like, really looking at me like, get me out of the mud, would you? So there I am in my robe, and I'm like, well, ain't much to do. So I throw off the robe. We're out in the middle of the country, by the way, walking around buck naked, jump down in the mud with him and pull him back up to where he can get back on the deck. And needless to say, we both needed a bath at that point. But I kept doing that every morning with him. He was so happy. He felt good. I felt better too, because I'm getting up first thing in the morning. We're looking at the glorious sunshine out at the end of the marsh, and the water coming in, or the water there, and the birds, and it was just, wow, talk about reviving the soul. That was awesome. So Arnold lived another month after that. And that doesn't sound like that, but he was a lot happier, and he felt better, and I felt better, and we were both happy about everything. So that's what I got to tell you. The little things, we think about bucket lists being big trips for us. Like right now, Mary Jo and I are on the bucket list of our lives. We are traveling. We're in Taos right now. We're getting ready to head to Santa Fe. We're meeting all these wonderful people. We're meeting indigenous Native Americans, learning their culture. They're sharing with us. It's wonderful. I mean, this freedom that we've gotten to travel, that's a big thing. But for Mona, she doesn't care where we are. The big thing is to take that walk every day. Even if we're carrying her for more than half the time, she gets out, she gets to see, she looks across the horizon, she interacts with other dogs if they're around us in the neighborhood. That makes her day. She's happy as a clam. So what if she's only walking 3 blocks? She's not hurting. If we miss and she jumps up on the sofa once or twice, it's not a disaster where she's painful for 2 days and we have to use medication for a while. So we've gotten to a place where we've made peace with what she can do, and we still keep her happy. So that's what I've got for you this week. If you need help figuring out what to do for your pet, I am really good at that. And through the end of this month, we will give you, if you purchase the advanced care package, which is a longer 2-call package with roughly 60 days of follow-up interaction, we'll give you 12 free jars of holistic total body support for dog or cat. Your choice. And if you think a little, you just kind of need a good head start and get a game plan together, I also have a one phone call with email follow-up, so it's basically a 30-day program. Purchase that and you'll get 6 free jars of holistic total body support. So that's what I've got. Let me see, I think there's a couple of questions in there. Good to see everybody. And as you all know, all my CrockPet chefs, we're going to head back over to that site in about 10 minutes and do some question roundups there. Yeah, Linda, I love that. Belly rubs are as good as medicine in our house. That is the amen truth. And then Erin is asking about Gozer and Mongo getting mucus stool or diarrhea, and she's had it checked for parasites and blah, blah, blah. And so what's going on with that? So, Erin, here's the sad truth about fecal tests. They only pick up about 11% of the positive infections. So it is possible that you've got parasites, although you're in LA, so it's pretty unlikely because it's just not a very good environment for parasites to thrive, so to speak. So I would look at what's going on in the food. Is there something new? Maybe they've had enough of something. I know you do a lot of krauts and things of that nature, and so sometimes if there's sort of changeover in the bacterial flora, that can make things get a little worse. So if you've been using something consistently for the last several months, I'd stop it for a little bit, see if that makes it better. Or conversely, if you've added something new into the diet, see if taking that back out helps or not. So again, we talk a lot about the original CrockPet diet, which is a home-cooked meal that you make for your pets, and that's kind of, to me, that's the basis of nutrition. And the deal is, it's a basic recipe, so you put in what's good for your pet and you can take away the things that are not, so you can control the ingredients specifically. What I really strongly encourage people to do is rotate all the ingredients, because if you eat the same thing day in and day out and you have leaky gut syndrome, your immune system will begin to respond to it. So that's what I got. So we're going to head over to the CrockPet page and the CrockPet group if you want to join this. This is a kraut, so sauerkraut's April. I think Erin makes a ton of different pickled and fermented vegetables for the pups. So that's good stuff. So that's one way to get probiotics and prebiotics into you and your pet, for that matter. So we're going to head over to the CrockPet group, and if you want to join the group, and it's really simple. If you haven't purchased the original CrockPet diet or one of my other digital classes, or if you've not had a consultation with me, these are all ways to get access to that recipe and members area. We've got an awesome group where people are supporting each other. There's people with years of experience with cooking for their pets that are coming from a lot of different traditions. It's just, it's a great place to be. And so every Monday after this session, I go into the group and teach a little bit, answer questions, help people out specifically with their pets. So that's what I got for you. Until next week, remember, your pet's best health starts in the bowl. Take good care. I'm Dr. Ruth Roberts, your pet's ally.